Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity.
I'm Kerry Fink, and welcome to Helping Seniors Television. On behalf of Joe Steckler, our president and founder, Nancy Deerdorf, our operations director, it's a pleasure to have you with us today. We are going to really dive into something that if you're over the age of 65, this is very, very important to pay attention to. And what we're talking about actually is your Medicare coverage. And so often people don't really understand what's available to them. All I know is you get to a certain time of year and your mailbox gets flooded with all these different offers, and this is the best plan. Oftentimes we'll see things on television and it says, call us, give us your zip code, and we can work out the best possible situation for you. And all this sounds really good, but it really doesn't matter until you can figure out how the rubber actually hits the road, and is this health plan is gonna be useful for you, in particular in your particular situation. Our president and founder, Joe Steckler, talks about making an aging plan. What he means by that is having a plan that is going to give you the best possible quality of life, that you've thought about different contingencies and things that you might want to be considering. And so that's one of the reasons why Helping Seniors is so blessed to partner with real experts. I always use this. I want to go ahead and introduce our guest. She's a friend of the Helping Seniors Network. Her name is Marisa Mitchell. You're an expert at Medicare. Welcome. How are you today?
Thank you. I'm doing great. Thank you. I'm trying to stay out of this Florida heat.
Well, you know, we're talking about this Medicare question because we have this expression. First of all, in the Helping Seniors Network, we say this is aging plan is kind of like we're trying to help people get your ducks in a row, meaning you've thought about the things that are important to you. Let's make sure that we've got everything lined up so you're getting what you want. But the second part of this that we keep learning as we talk to people about getting your ducks in a row, the corollary is don't try this on your own.
No.
You know, you get all this stuff in the mail, and maybe on the front page it looks really good, but then you start thumbing through this thing, which is like not even yellow page paper, but it's this real flimsy stuff, and it's got all these terms and conditions, and there you are. You've got 3 of these things sitting on your dining room table, and you're trying to figure out how to get the best situation for you, for your own case. And yet it could be as simple as calling an expert like yourself, pick up the phone and say, here's where I'm at. I've got all this stuff. How do I decide? Because you're an independent agent, which means you're really able to look at a lot of different options for each person you come in contact with. Am
Absolutely.
I saying that right?
Yes. And every year I have to be certified through the Centers for Medicare, and then I have to train and pass qualifications and everything for each insurance company. And so right now we're smack in the middle of all of the rollouts that they're preparing us so that we can be ready to go on October 1st. So there's a lot of companies that are available, and each one is very different. So it's really important to really get down and look at each individual plan, because people's needs can range so much.
You know, I was going to ask you, because really, if you think about it, so you have a long background. As you were telling me that you actually have medical assistant office experience, and then you worked for a large national carrier, and that kind of gave you the love and the passion to help people. But now you're in a situation where you really are able to drive people outside of, outside of really any limitations, to kind of look at all the options that are on the table to match up the best solution. And I thought, as we talk today, maybe a place we need to start with is, I hear so much confusion out in the marketplace about Medicare, and people confuse it with Medicaid, that we don't really, as consumers, necessarily understand the difference. When you sit down with somebody and you say, hey, you're about to turn 65, that means you're going to be ready for Medicare. How do you walk a person through like the decision-making process?
So I always start with their individual goals, because some people, when they're turning 65, they're like, you know what, I'm not ready to retire yet. So what do I do? And at that point, I go over their options, if they're going to continue to work, or if, they're like, I've been dreaming of this day for my whole life and I'm finally there. I'm going to turn in my notice and that's it. I'm ready for my retirement. Then, we look to see, typically, it takes time to get all of these things organized. So if somebody's going to go on Medicare when they turn 65, they're granted like a 7-month initial enrollment period. So it starts the 3 months before their birthday, their month of their birth, and 3 months after. And of course, you have to call Social Security if you're not already receiving Social Security so that they can activate your A and B. And then once you have your card in hand, that's when you're able to kind of really make the decisions as to how you're going to decide to receive your benefits, because there's a lot of different ways. It's not just, here's my Medicare card, we're done.
Right. It's kind of where it just starts, right? But you're already ahead of me, because you were talking about you get your A and B parts, and I don't know that it's necessarily safe. I'm just thinking about myself. I don't know it's necessarily safe to think that we really understand what Part A and Part B is. I assume those are the parts that when you get that little Medicare card, that's what's included in that. Talk about that for a minute, like a primer in case somebody's not familiar, like myself.
So the parts of Medicare, when you get that Medicare card, it has a red, white, and blue card, and it has the A on there and it has a B on there. And the A is for all the hospital, anything that's inpatient, if you're skilled nursing facility, things like that. Those are all included in the A, and then the B is like the other doctors. Think your primary care providers, your specialists, durable medical equipment. So if you needed a wheelchair, it's under the B, and even some vaccines are covered under B as well.
Okay, so when you get that card, though, people assume, well, I'm covered for everything, but that's not really the case, because you still have deductibles and co-payments and things like that, right?
Yep, absolutely. And typically, most people, as long as you work 10 years, pay into Social Security, the Part A doesn't have a cost to it, but the Part B does.
Okay.
This year for 2022, the Part B premium is $171.10. And typically most people they get it withdrawn from their Social Security, but it doesn't include drug coverage and other things like that.
Wow. So is that where we come down to this discussion of things that happen a lot? Because I've heard people oftentimes, once they get that card, then they tend to go in a couple of different directions. Number one, they might say, well, I want a Medicare supplement that helps me pay some of these kind of costs. But then I've also heard the other side of it, where I can get another type of Medicare through a provider where they kind of manage the care.
Right.
Is that Plan C? Is that what I'm talking about?
Medicare Advantage, and then if that operates different, because Original Medicare is a federal program managed through Social Security, but Medicare Advantage plans are all managed by the individual insurance companies.
Okay.
So all the different companies, they come out with their own plans. They're specific to the areas that you live in. So the plans will be different here than they are down in Miami or in Orlando. They vary by zip code.
So you would either take a Medicare Advantage plan to sort of ride on top of your original Medicare coverage, or how does that play out?
Not really. It's an alternative.
Okay.
It's an alternative. Original Medicare doesn't have any kind of networks. They don't have any kind of prior authorization, requirements or referrals or things like that. But it can be kind of expensive. Just for hospitalization, the deductible is over $1,500.
Wow.
And so that's why a lot of people can pair that with a Medicare supplement or a Medigap plan, because those are also offered by the private insurance companies, but they have a monthly premium every month. So, but they are standardized by the government. So they go anywhere from A through N, and then they have a monthly premium. And if you decide to go the original Medicare route, you would have to have separate prescription drug coverage as well. So you would have your monthly premium for your B. You would have your Medicare supplement cost every month for the premium, and then you would have a premium for the drug costs as well.
Wow. So then is that maybe a reason that a lot of people take a look at these Medicare Advantage plans?
I think that's why they are gaining in more and more popularity, because with the Medicare Advantage plan, you can join it, and it has the A for the hospital, the B, and the drug all in one. They bundle it all in one for you. And then, but then you're no longer getting your benefits through Medicare, you're actually getting it through your private insurance carrier instead.
Okay.
Yeah.
And that's why you have to stay a lot of times inside network and things like that?
They can be, there's different types of Medicare Advantage plans. Some of them are PPO, which allow for in and out of network benefits. And then some of them are HMOs. The HMOs, definitely, you would have to stay in network for all of your service providers.
So, for example, I've heard it said, I don't know if it's true, that, for people who are snowbirds spending part of the time maybe up north and then they come down here maybe through the winter months and things like that, that can be a challenge for like a Medicare type plan. I'm sorry,
for Medicare Advantage?
Yeah.
It can be, but sometimes it can't. It just depends on the carrier. Some carriers have a smaller service area than other carriers. Some of the national carriers, are available in more states.
Okay.
So it just depends on the type of plan that you get, and that's usually why it's really important to kind of have a sit down with somebody to find out what your lifestyle is, because some people, they're in this county and they never leave, and that's okay, So they might be good with a local carrier that mostly is specific to this area. However, we here in Florida, we have lots of snowbirds.
Yeah.
So they would probably be better off with maybe one of the larger carriers, just because they're able to have that little bit of flexibility for the network choices.
I guess these are the questions. Nancy Deardorff, our operations director, has this expression that she likes to use. And it's really so true. She goes, how do you know what you don't know? And isn't that really the problem, is that most of us, we don't really know, and we need the guidance or the assistance of somebody that's really well versed in the marketplace to help look at our situation and say, this might be the best for you. And as a corollary to that, I know we hear a lot of times people see somebody famous on TV saying, call this 1-800 number because we can look you up by zip code and get you all set up. To me, that always feels, even though I like the person I'm watching on TV, it feels a little bit suspect, because I'm thinking, how do you know which doctor would be available to me in, say, Palm Bay, Florida, and things like that? I think that's why it would make sense to call somebody like yourself locally who understands and knows our market conditions.
I'm very blessed because I've been able to work with a lot of people in the community, such as yourself. And going to these local events, you can come out and see me at a lot of local events. But I also have a great relationship with some of the doctor groups here in Brevard, and I get to go visit their doctor's offices. A lot of times I get to meet the doctors. So it kind of allows me to kind of when I sit down with somebody and somebody says, well, I'm looking for a doctor that kind of is like this or like that. I'm like, oh, well, in your area, I know this doctor. So that also, I feel, kind of helps me get to be able to be a better service to people, because I'm able to kind of not just know them, but also the local doctors in their community. So I love that part of when we sit down with somebody to go over their options, that I can be another source of information.
Yeah, and we were talking also before we began with the TV program. I was asking you about people who, I hear a lot of times people start complaining about their drug coverage because they get to a certain point of the year and they fall into what they call a donut hole, where all of a sudden they're responsible for some period of time, like a way more portion of the cost of their medications they were during the early part of the year. And I also remember you saying that that's one of the things that you like to do when you sit down with somebody. You said, I almost like to start with taking a look at where they are on that in terms of trying to craft what's going to make the most sense for them.
Right. Yeah. I mean, that is the best place to start, because each carrier has a formulary, and the way that the medications can be covered can be wildly different from one carrier to another. So I usually typically start with people's medications, just because that I want to make sure that they're going to be covered, where the person knows this is what I can expect at the beginning of the year, the donut hole and everything. And then we kind of go from there to their providers after that. So a lot of times I go ahead and I put in their medications, and it kind of tends to lead the conversation as to which way we're going to go when we're looking at all the different options.
Yeah, so at that point, it's really not guesswork because
No.
you're looking at actual data like this is what my friend here needs to make sure they have access to.
Right, absolutely. Yeah, because that can make a huge difference.
Yeah.
And I've seen just, differences, sometimes hundreds or even thousands of dollars of difference if we don't start there.
Right, and there's another thing that you mentioned, which I hadn't even thought about, because I know it's a mistake at what they call like open enrollment time to just blindly resubscribe to whatever you had, because there could be changes in the plan that what might have been great this year for you, but because of a change that got written into it, may not necessarily do you the same way the next year. Am I saying that right?
No, you are absolutely correct. You're absolutely correct. Every year, probably September-ish, maybe a little bit earlier, a little bit later than that, you should be receiving a notice from your carrier. It's called your annual notice of change. And they send it to you, and they expect that you're going to look at it, so that if your copay was here and now it's here, a lot of people maybe review them. Sometimes they might throw them away into the recycling without even taking a look at them. And then it's not until January, all of a sudden you go to see your specialist, and they're like, well, wait a second, why is my copay higher? Or you go to get your prescriptions, and your medication from that was in tier 1, all of a sudden now it's on tier 2, or something that it's like people are like, whoa. So I really, really recommend to sit down, go over your annual notice of change, and to sit with a professional, to just sit down and go over them so that you can see what are your options, because there's a lot of different carriers, and also there's always new carriers that are coming or leaving and things like that. So that's where we shine. We get to like give you the scoop as to what's going to happen for the coming year.
And when you were saying that about coming and going, I thought about that. You said, this is another thing I hadn't thought about until you mentioned it. You said, a lot of times people say, well, I got my plan, I'm set for the year. But then you said, but doctors often will come and go from plans too. So just because you started with a certain plan and your doctor was there, if they leave that, then you may have to reconfigure everything anyway.
Yeah. I mean, doctors are humans just like us. They get sick, they die, they move. So it's, a lot of people, they want to keep their doctors. And so, you have to have that flexibility, because sometimes the carriers, they do their best, they contract with companies and all of with the doctors and everything, but that can change. And so, it's nice to be able to have somebody that, like myself, my clients will call me if their doctor leaves, and if their doctor's all of a sudden, well, I'm not going to take that insurance, but I can take this one. We can kind of work around to see if maybe there's some kind of special election period or something that would allow them to maintain their doctors. And I've been able to do that for some of my clients as well.
So that was actually another question I was going to go try to drill down a little bit anyway, was suppose that we didn't do a good job of reading our fine print and we just blindly took a plan, and we're getting now into the next year. I know there's a little bit of wiggle room at the start of the year. If you weren't happy with a plan, you could make a change. But what if you're like halfway through the year and you're really like getting crushed by the situation? Are there options even if we didn't do our homework the right way?
There could be. I mean, that's what typically I'm doing all around this time is, if somebody, maybe somebody moved from one county to another, and they might have a special election period because of that. There are 5-star plans in the area that maybe they might be able to change to. Some people might have certain benefits. There's if you get extra help, from the government to help reduce your copays and such. Somebody's eligible for that. They're able to make changes throughout the year. So those are kind of some of the things that I look at when I sit down with somebody. Because you may not have to be locked into the plan that you're in.
Yeah, and the other thing is that so many people now are moving to Florida, like in almost unprecedented numbers. And so you got a lot of people who may be moving to the state that may come from up north, out west, or something like that. And now they've got to kind of recalibrate what's going on for them. They don't have to necessarily wait till an open enrollment period. If they moved
Right.
in, there's an opportunity for them to sit down with you any time of the year.
Absolutely.
It just has to be within a certain time of the move.
Yes, they have 2 full months when they move, and then we can look at what their options are. I mean, because depending on the situation, I mean, if it's an Advantage plan, we might be able to just switch them to another Advantage plan. But a lot of times, people, if they have a supplement, they just need to notify the company, but their drug plan has to change because drug plans and Medicare Advantage, like we said before, those are specific to zip codes. So if you leave the zip code, that might give you a change, to allow you to change to a different plan.
There's so many dimensions of this, and that's why I really go, this is like not a good area to be trying this on your own, because you really have to go to a lot of schooling every year to just kind of keep up with everything that's moving on in the industry. Talk a little bit about that.
So every year I have to do something called an AHIP, where I'm able to have to go through all of the changes in Medicare, ethics, law, and all of these different things. So it's kind of intensive. And then once I'm certified with them, I'm able to give that to all of my carriers.
Yeah.
And then my carriers bring me in, and I have to do all their training for each individual carrier.
Wow.
So that can take a lot of time. But then, you get the fun stuff. You get to go to the carriers, have trainings for us, a lot of times in great locations. I think one of them is going to be over at the Kennedy Space Center, for instance.
Oh, cool.
And so they'll be able to tell us, these are the changes for the coming year, and they want to make sure, but we have to be tested and certified with each person. So, I mean, it is very intensive.
Yeah. And so again, what is fascinating to me is like you go through all this training, you become sort of a subject matter expert so that you're in a position to really advise somebody based not only on general, stuff, but literally get very granular down to what the specific needs are, what the specific medical history is, prescription history. And your options seem really straightforward. You're either going to look at all this stuff that comes in your mailbox and kind of like, I'll go this one. Or you would talk to somebody who really knows what's going on, who has access to tools to help really come up with the best plan, like yourself. But it doesn't cost anything to talk to you.
Nope, they do not have to pay. I don't charge any fees when I sit down for an appointment with people, because I'm appointed and with all of these different companies. If I help the person, then the company pays me directly. And then I also stay with them through throughout the year. So if I have clients and they have issues with accessing their care, or they want to change their provider, or if they just have questions about like, well, do I need to have a referral for this? A lot of times they don't even have to call the carrier directly. I've helped my clients resolve issues with billing and things like that. So I feel like that is also another added benefit of working with somebody like myself.
And then also you've got, like we talked about before, it's not like you haven't been doing this for quite a while. So you've got a lot of experience built up, not only in this whole Medicare arena, but also with a lot of these different carriers too.
Mm-hmm. Yep.
So how do people, if they're interested in this, say, well, this has been a fascinating conversation, what's the best next step? I guess it's probably to get in contact with you and say, hey, I'd like to kind of show you what I've got on my coverages and see if I'm doing this the right way, or if maybe there's a better idea. Is that?
Yep, they can just call me at 321-361-1040. I'm listed, of course, in the Helping Seniors directory. Yeah. And then I'm also on Facebook and, all the usual ways to get in touch with people like that. You can Google my name and you'll find me. So
it's Marisa Mitchell. And, really, I think one of the things that just comes up over and over, we talk about getting an aging plan together so that that you've considered what the different things that you might want to be concerned with about. And number two, you want to build a team of professionals around you that can really give you answers, so you're not guessing, or you're not having to find some fine print on page 49 of some big manual. And again, if it's not going to cost you anything to have this help, why, I guess the question is, why would somebody not call you? I can't think of a reason.
I meet people every day that they either call one of those 800 numbers and they've been burned or something, or a lot of times they turn to friends, family, neighbors to see what they have and everything. And of course, they're not licensed agents. They're not familiar with all of the plans and all of that. So I encourage everybody, either myself or another independent broker, just sit down with us and have that conversation.
Yeah, well, it's not only that, but you're right. Even if you sit down and so, you're talking to your neighbor and they say, I got this plan and I really like it. Well, that could be perfect for them, but your situation might dictate something different, right?
Absolutely, yep.
Yeah, so you can't really just go by that. You've really got to have somebody look at the ins and outs of your stuff. And usually, even if you call the doctor's office, they're too busy seeing patients. They don't have the time to walk you through that. You need to sit down with an insurance expert. So one more time, if somebody wants to call Marisa Mitchell and say, hey, I'd just like to have you take a look at where I am, and is this the best plan, or is there a better thing I should be considering? How do they reach you again?
You can call me at 321-361-1040.
All right, Marisa Mitchell, you're independent insurance agent, expert in Medicare. And we thank you, by the way, for being part of the Helping Seniors team. You're right. You can find the listing for Marisa in the Helping Seniors directory. You can get that in the center section of Senior Scene magazine, or you can go to helpingseniors.directory.com, or you just call our senior information helpline at 321-473-7770, and Nancy Deerdorf, our operations director, will get you right in contact with Marisa. So thank you for Marisa for sharing a little bit of insight and some of the value that you create for the people that you work with on Medicare.
Well, thank you. I really appreciate it. And I don't know if I mentioned this or not, but typically I do house calls. So I come to you and I sit at your kitchen table and go over everything in a private, confidential manner.
Wonderful. Well, thank you, Marisa, and thank you, viewer, for joining us on today's Helping Seniors TV program. We'll see you next time.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.